Welcome to the Mindful Table Talk with Health Empowerment Coach Joanna Mickel and myself, Maame-Mensima Horne, Naturopathic Doctor. At the Mindful Table Talk, we discuss natural approaches to health and wellness with an emphasis on mindful. So today, we just wanted to introduce ourselves. So I'm going to introduce my friend and colleague, Health Empowerment Coach Joanna Mickel. We met in naturopathic school, so she has a strong foundation in naturopathic medicine. And while we were studying, she fell in love with Chinese medicine. And now she is pursuing her Doctor of Acupuncture in Chinese medicine, right?
Well,
Yay.
hello, everybody, and well, it's evening here. So I just want to introduce myself. I am a health empowerment coach. The reason being is I love to empower individuals to take back their health and to um, get to learn about how their body works, to fall in love with how, to feel healthy, how to understand the body, how to fuel the body. And so just like Dr. Maame-Mensima mentioned, I have over 2 years in naturopathic school. While I was there, I fell in love with Chinese medicine, so I shifted gears, and now I am at Taoist Traditions College of Naturopath, or excuse me, Chinese Medical Arts. See, I still love my naturopathy background as well. And so I've been there for over 2 years, or about 2 years now, getting ready to go into clinic there. So it has been quite a journey of learning both of these styles of medicine. And, my undergrad is in nutrition. So, of course, nutrition is my first love. So that's really where I'm currently working, is in that nutrition realm, along with stress management and fitness, because those are the foundations of health. So definitely staying within that lifestyle medicine, you might call it, and which we're going to talk about in a future mindful table about the therapeutic order. And so that's a little bit about me. And I'm going to turn it back over so Dr. Maame-Mensima can tell you a bit about her.
Thank you, Joanna. Yeah, so I'm a naturopathic doctor who also studies Chinese medicine. Um, I also fell in love with Chinese medicine and knew that I wanted to kind of blend the two from some of the modalities that we can only use more in the naturopathic medicine perspective. So I'm kind of grateful for that. But I'm based in Los Angeles, California, where I do have a practice, Heart Body Glow Naturopathic, where I do naturopathic medicine and I integrate mind body medicine. So, clinical hypnotherapy and Reiki, meditation, and breathing, sometimes movement. I am a yoga certified yoga instructor, and I actually fell in love with natural medicine because of yoga. So I never really left those roots. I was inspired to learn about tongue and pulse diagnosis when an Ayurvedic doctor came and spoke to our class. And then it was like, oh, I need to learn more. I was asking everybody, what's your dosha? And although I don't practice Ayurveda, from a training perspective, it is a practice that I also love and
Mhm.
incorporate with some of my patients depending on their background, their needs, especially if somebody wants to geek about Ayurveda. It's like, oh my gosh. Yeah.
That's right.
I'm like, I'm sure you can relate. Like somebody comes in, it's like, oh my gosh, I'm a O blood type.
Yeah, that's right. And then I would love to jump into conversation, me.
Go ahead, we could
you
talk.
know, when you were talking about, the Ayurvedic, there's so many different perspectives on health from all the different traditional medicines, right? And that's what I love about natural medicine is it tries to bring in all those different types of medicine, all the different ways we can take a look at individuals' health. We have Chinese medicine that's been around for thousands of years. We've got Ayurvedic medicine that's been around for thousands of years, you know, and I think that's our passion is bringing that knowledge, again, health empowerment coach on me, and for you as a naturopath, is we have to educate, and get people to realize there's other ways that we can approach health, um, and perspectives that actually can find the root cause of individuals' needs or health care that goes beyond what we understand as Western medicine, right? So we get to see people in different avenues. Like you said, what's your dosha? Aruveda Kappa Pitta. What is your blend? Like me, I'm a Pitta Veda. That's me. Very much fire and air. Probably need some more grounding there, but and I've done a little bit of study in the Ayurvedic nutrition side. It's very
Yeah.
little, very little. But it's interesting to see all these ways we can look at health expand upon it.
No, definitely. I totally agree that there are so many different perspectives. The last year so I was studying a little bit of Korean medicine, went to Korea, South Korea, and then also some of the Korean medicine doctors came to the US and my school in
Mhm.
Lombard, Illinois. And there is this whole constitutional medicine that
Mhm.
exists that is even more different. And it's like based off of yin and yang, right? So
Yeah,
you have
right. Yeah.
excess yang, excess yin, and then it's
Yeah.
like, oh, more yin, what is it? More yin than
Yeah.
yang, more
Yeah.
yang than yin. And then
Mhm.
based off of those patterns, so there's four patterns that
Mhm.
they essentially will guide and treat from. And
Yeah.
from my understanding, we visited some hospitals while we were in South Korea, and like difficult, like inoperable cancers, inoperable diseases, or untreatable diseases, that's where they would go to the traditional medicine hospital and do constitutional medicine, because it's
Yeah.
not about treating the disease, it's about treating the person, helping them
Mhm.
to understand how their constitution
Yeah.
is like has a predisposition to
Mhm.
certain patterns of
Yeah.
disease. So being able to kind of mitigate that, and from that they're able to encourage health. And so I found that to be really inspiring, and that's one of the reasons why I decided to continue my education, because
Mhm.
there's so much, like you said, beyond the conventional model. The
Yeah.
conventional model, if we really look at it, it's very, it's like very new
Mhm. Right.
compared
Yeah.
to the oldest medicines, recorded medicines
Yeah.
that like we know traditional Chinese medicine, or like the classics were
Mhm.
written over 2,000 years ago.
Yeah.
And what's fascinating is the things in the classics, you follow them and they still
Just
work.
going on.
They still
Yeah.
work. And I
Yeah.
mean, there are a lot of modifications and changes
Mhm.
over the years, the centuries, the
Yeah.
millennia. But at the core, if there's an excess, you have to release it. If there's a deficiency, you need to tonify. And
Yeah.
if you understand that, and I mean, like we look at, even from a naturopathic medicine, we're looking at deficiencies or overindulgence or whatever it is of
Yeah.
lifestyle
Yeah.
to actually make the changes. Like, why am I giving you iron? Because you have, that kind of
Yeah.
thing. It's like,
Yep.
let's treat the deficiency.
Yeah.
Or if there's too much, how do we make a shift?
Yeah. So, we're talking about all these different viewpoints of how we can approach medicine. So, how do it's like I like to call it like your toolbox or your art, you know, your paints or your palettes or the medium you use for medicine, that's why I love the school name that I have. It's the medical arts. There is an art to it. So, how do you approach medicine at your practice?
So I actually look at it and I know we'll talk about this in a later episode,
Yeah.
looking at the therapeutic order. So in naturopathic medicine, we have what is called a therapeutic order.
Mhm.
And at the base of the therapeutic order, we are addressing the determinants of health. So
Mhm.
that is your diet, your nutrition. Are you getting fresh air? Are you active? Are
Mhm.
there any environmental concerns? Like, what are the things that may be impacting your health at a very fundamental level? And
Mhm.
then from there, like I follow it. I like, let's stimulate the body's natural response, the vis medicatrix nichirai.
Mhm. Yeah.
And then I'm looking at how can I tonify the weakened systems and also support the body's elimination pathways. So from when we look at, as a naturopathic doctor, when I look at the philosophy and the literature that is left, which is, our literature, we have things from 200 years ago, we have things from, or books from 200 years ago, books from over 100 years now. And even that information, as you know, like Henry Lindlar,
Mhm.
his Nature Cure and what is it, Natural Therapeutics, looking
Mhm.
at those is still very similar. Where, if I follow, I mean, you don't have to get into the details of like his where he's coming from or why, like the jargon or the drive of looking outside of the conventional model, because he was looking outside of, if you have a pathogen, that means you're going to get sick. He said that, susceptibility is really the things. If you create health, an environment of health, you'll have health. If there is an environment of disease, you'll have disease. So looking at how can I support and tonify weakened organs, and make sure that people are having regular eliminations, whether it's bowel or bowel movements, or they're urinating like adequately, frequently, and it's not like you're dehydrated,
Mhm.
or it's so much like, and it doesn't stop, or you're waking up 3 or 4 times a night, all of the things that in Chinese medicine we'll also
Yeah.
look at, is this an excess pattern or deficient pattern?
Right.
um, Looking at that and then making recommendations. I love herbal medicine, like botanical medicine. I love creating my own formula. So instead of my patients getting a lot of supplements, like early in my, like, as I start, like it's hard when you're starting out, you got to start somewhere, and it's nice when you can like order supplementation. But I'm working with like local herbalists to help me actually be able to create individualized tinctures that I can
Mhm.
actually get in my patient's hands, so
Yeah.
that they leave home with a special formula like they used to do back in the days, where they'll make medicine for you. And in our training, in my training, I was making formulas recommended by the what are the symptoms
Mhm.
that the patient is coming in, and what does that mean as far as like the organs that need to be supported. So I use that. I also use homeopathy a lot. I did a clinical externship in homeopathy, and then my mind body medicine is like bread and butter. No, it's like what I love. Um,
Yeah.
Really healing trauma using hypnotherapy and other mind body therapies that, like a hypnotherapy session is a very involved session. So I've also modified my practice for like more like intense. Let's work on one thing. Like if somebody, like I had a patient who came in with like hypertension and palpitations,
Mhm.
and it was like acute, and it started and it was stress related. So working with them in that moment, utilizing like not just visualization, but it's called focusing therapy. I learned it along the way,
Yeah.
but it's one of the tools that I use to help in a like short period of time to kind
Mhm.
of get a therapeutic result using the mind body continuum. And then, of course, I love physical medicine. I trained in
Mhm.
massage therapy. I like doing yoga. You kind of like the physical body, touching, moving, manipulating the soft tissue, like. back in Illinois, I love doing joint play and actually doing manipulations. But like here in California, I can do the joint play, but I'm not necessarily doing like the manipulations like you would find a chiropractor to do.
Yeah.
But yeah, so I mean, I kind of keep it in the realm of the traditional naturopathic medicine.
Mhm.
Um, and as needed, I incorporate what my patient may need.
Yeah.
Um, and it's kind of cool because you're like, well, what can you do with that? Like one of the like I guess patient populations I've been working with is actually like around oncology and
Mhm.
helping people align mind, body, and spirit so that their treatments are more effective, releasing the anxiety, the fears, because there's a lot like the fear of dying, there's the fear of the unknown, there's so many things that come up. And then there's also like one of my they were a client at the time when I first started because I was doing the hypnotherapy while I was in school. It's like anger. Like,
Mhm.
so I started looking at the research between suppressed emotions and how that actually, because suppressed emotions impact the immune system and the nervous system, people are not able, like, you're not able to fight disease. Our bodies are like, cancer tumors grow, but they also get like our bodies are able to regulate them. So when
Mhm.
our immune systems are suppressed due to, like they would say in Chinese medicine, qi stagnation,
Mhm.
like the energy just gets stuck, whether it's in the organ or in the vessels, like the blood vessels or whatever, however it manifests for the patient, being
Mhm.
able to help release those stuck emotions, especially from a long time ago, helps them to like release a lot of the anxiety, but have the confidence to move forward. So that's
Yeah.
kind of like what I'm doing. So Howard, like tell me a little bit more about this health empowerment coaching that you are doing. Like, and what do you like how do you integrate your knowledge thus far? Because I mean, I know you're probably pulling from the naturopathic toolkit yourself. Like, tell me about how you're using your knowledge to support your clients.
Yeah, so definitely have I have that love for naturopathy and the love for Chinese medicine. I'm North Carolina, so we are not a licensed state for naturopathic medicine, but we are a licensed state for acupuncture and Chinese medicine. And of course, I wanted to do acupuncture Chinese medicine when I came back, and so in of course Arizona, they kind of have it in a sense umbrellaed under naturopathy if you stayed there. But you still have to get licensed if you leave the state. So I'm like, I got to go get this. So I decided to come back. And so while I'm completing that degree, I decided I want to start helping people. And so understanding some of the tools that I've learned with my undergrad in nutrition and then what I've gained at naturopathic medical school is, I can help in that foundational piece, the lifestyle medicine, so to speak. And so I love the therapeutic order. So I'm like, I'm right there at the bottom. I got that piece. And, that's a pretty big piece,
Right.
people don't realize. And it's really not so much the practitioner at that level. It is the individual at that level. And they have to do the lifestyle. We can't go and feed them. We
No.
can encourage them to eat appropriately, but we can't feed them. We can't make them go run around the track. And we can't change the way they think. We have to give them the knowledge that they can apply that to themselves. And so that's what health empowerment coaching is about, is to empower them to be able to take their practitioner view, part in their health and being able to deal with the nutrition, the fitness, and the stress management, the things that they do on a daily basis. And a lot of people don't have that understanding in those three areas. And they're just getting bombarded with information on social media. Here's how you're supposed to do it. There's how you do it. And they get confused because of course, you got the extremes in nutrition, right? Carnivore diet, vegan diet, vegetarian, Dr. Atkins, go, any which way. And there's research for all of these diets. It's
Mhm.
true. But again, it's really the majority in each of these diets is only about 50%, 52%, 55%. What's about the other 42? That's why it flip-flops. So it's really about the individual. And that's what we're about at Health Empowerment Coaching is the individual. It's like teaching you how to listen to your body get back into the body because we've forgot about it. Life is this, we just go through life and we forget to connect the mind and body. So there's the other part of the mind body medicine is really just putting them back together and saying, hey, they're meant to coexist. Of course, back they talk about Newton time and what's the Descartes,
Mm-hmm.
who separated the mind and the body back then, and it's kind of created the mental thinking that's come into Western
Scheme of
civilization, which really has screwed us up in a sense because we've got that disconnect. And so we as naturopaths and holistic healthcare practitioners want to bring them back together. And so that's kind of what I do is try to get people back to connecting the two sides. And so anyway, so I love, of course, the therapeutic order and the naturopathic principles where a doctor is teacher. Well, that's my first. Anyway, I'm gonna be a teacher, right? That's what I'm doing now. I'm gonna at least get that one down pat before I
Yeah.
can incorporate some of
You
those other ones.
you
So
teaching is like that I feel like that's your love. So
it
I'm glad that no matter what, you're gonna teach.
Yeah, and I love to see people's eyes brighten up when they're like, "Oh, that's why that happens."
Mm,
When you're explaining to them how the body, like you were talking about, how the immune system, when you're holding on to all those emotions and you're depressing the immune system, so it can and opens up that susceptibility to, illnesses. A lot of people, colds and flus, why is it that happens? Well, lots of times you're in a stress state. It
yep.
opens you up. And then, of course, in the wintertime, we ain't got vitamin D. So we got, talking about deficiencies, we got to boost the deficiency of vitamin D, and that's where talking to, Dr. Maame-Mensima to say, hey, what's going on? How can I shore up my body so I don't get all the flus and things that seem to be going around? What kind of things do I need to support my system with? I can just kind of give them, here's the nutrition things that you can do. Here's the exercise things. And of course, you got to put those in balance, which you were talking about balance there a minute. Did you want to share a bit? Because I think that's really the roots of even Chinese. I know it is for Chinese medicine from bringing there is keeping that balance in there.
Yeah.
And how do you do that with your patients? Really kind of helping.
Yeah, so I mean, really working on that mind body continuum, right? Like it's just
Yeah.
like you were saying, and I think it's something that we both do is the education piece and
Mhm.
really helping, like for me, it's using mind body medicine and breath and just
Mhm.
mindfulness to help people tune in to better understand their bodies, right? So like that can be as simple as, like even now, I mean, as long as you're not driving, you could just take a breath, right? And as you inhale and exhale, it's just noticing what's going on,
Mhm.
you
That
know?
helps right there because I know I was getting. You can hear my anxiety in my voice, can't you, when I'm talking?
Exactly.
I'm
Yeah.
noticing how calm you're talking. I'm like, "Doo-doo-doo-doo-doo." I'm like, can I do like Dr. Mommy and Mince? Just chill.
I mean, I think it's
But
also like being true to who we are, right?
it
You're
is.
out there running on the mountains, we would meet up. It's like, hey, you want to go hiking? Or I'm going to the mountain, and you're like running like up and down. And I'm just like, I'm just gonna walk quickly. I mean, I think I ran a little bit. I ran on my way down or something,
Yeah.
it's like a totally different vibe. And it's it's recognizing that we all have our own gifts, right?
Mm.
Like I've always been chill for the most part. I do get anxious. I get anxious over things that like, it's like the normal stuff that like I can't
Mhm.
even control anyways. Like so it's like right now in this moment, I'm not going to be thinking about that because this is something that I'm like, like it's like just being totally present, right?
Yeah.
And being able to notice, like, and it's weird. It's like, okay, like I really, I feel good right now. I do have a little pain. And when I like tune in, I'm like, okay, what's going on? And I'm like, oh, it's on my right side. And I'm doing a lot. It's like,
Yeah.
that trying to carry the weight of the world, my world, not really the whole world, but it's like
Yeah.
I've been doing a lot. And I notice like the pain came when I think about when did this happen? It happened earlier today. And I've been like on the from the morning, like just making things happen, right? I have to go to class, and I also am like organizing who am I going to see and scheduling and all these things. And it's like, sometimes it's like, whoa, okay, you did a lot. And now that I feel that, and I'm like, okay, I'm carrying the weight of the world. Is that what it is? Or I'm trying to, I'm do the most. Then that, like tonight, if I can make it, I'm gonna go do some yoga and allow
Mhm.
myself to kind of really release, through the holding the movements and then releasing and breathing and just being present on the mat. So I'm going to probably do that, or if not, I'm probably going to do some type of, soft tissue or something to kind of release the tension, right? So that's kind of like how I work. I feel like my like this moment is like what working with me is like, right? I'm pretty chill. Some people would say non-judgmental if that exists. I mean, we all have our judgments, but like, I'm like, I always joke, well, if you knew younger me, how can I judge anyone else, right? I'm
I
like,
think that's a good thing to think about.
yeah,
That's true. That's our goal, is to be a non-judgmental, and it's catching ourselves when our minds wander over and throw in those things. But I think that's the goal of the world should be, is try to catch ourselves, because yeah, we can't not be judgmental, because there are times we need to be a judge,
yeah,
but when we're in a space of healing and practice and working with someone, and I saw this myself, and I see it kind of getting incorporated in my coaching and doing some of the practicing I have to do, um, is seeing that when you step back from individuals and you give them space, you can actually allow them to open up more. When you put aside, the judgment, and really put them at ease, because I think a lot of times they come in with their own judgments to themselves, right? And
mhm,
that kind of puts up walls, and you have to really catch yourself to say, okay, because there is this stigma. I know in health coaching, kind of the big thing that brings people in is weight loss, right?
mhm,
And so they're already coming in with what the world says about being overweight and obese and da 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 da. And I've learned, a lot of that is coming from, metabolic problems. It's not that they get the stigma of being lazy or eating too much. And most of mine are not eating too much. It's quite the opposite. And I have to get them eating. And they're
yeah,
like,
yeah.
what?
The
And then
sluggish.
I have to have some, and I have to back them off what they're exercising, because they're creating cortisol responses, right?
Yeah.
And so it's getting that judgment away from them. And, and sometimes, things pop up because you got all those thoughts from in your head from social media and everything. And that's the other thing we have to silence, right? We get those social, what is it called?
Like the social,
Stereotypes stuck in our head.
yeah, yeah,
And we have to fight those
yeah.
thoughts too, and just give them opening, and shut ourselves down to say, this is a person that needs help, support, and healing. They don't need my judgment. They got enough of that in their own little bitty heads. I'd
Mhm.
say little
And in
bitty
their
heads.
own world, like
Yeah,
you're saying, like some people's families are just not supportive. So it's like,
yeah, right.
yeah, I mean, I think, yeah, like what you're saying, it's how to be with a person. I feel like that's actually the biggest gift as a doctor or a
Yes.
practitioner, is to be able to sit with a person and accept them as they are, allow them to
Yeah.
be seen. And as you said, a lot of people do come in with their own judgments and their own fears and their own anxieties.
Mhm.
So it's like helping them to become comfortable. And that's why I said, like, if like who I was before I became a doctor, I was probably more, I wasn't a mess, but there were times where it's like more of a mess than others. Sometimes I'm like, okay, like I was too normal. No, I don't know. Like this is a norm that I'm not necessarily like I don't necessarily subscribe to now, but like I feel like because I have that experience, like
Mhm.
I bring that, like I can never judge another person because I don't want anyone to judge me. And that's really what drove me to become a doctor, is
Yeah.
because when I was going through my own health stuff, I
Mhm.
was trying to be seen and understood, and a lot of people didn't understand
Mhm.
who I was and what I was experiencing. And it's not necessarily because they don't know or they couldn't relate. That was the thing. And
Mm-hmm.
I, for example, like I was told recently by someone, they made an assumption because I come from an academic family that my family is not spiritual or have a religious undertone, more spiritual, but still. And because I'm like a very spiritual person,
Mm-hmm.
and so I had to like I took a step back because this is a real thing that happens, right?
Uh-huh.
Like
Yeah.
people can be spiritual, but like even in academic settings,
Yeah.
no one wants to be that weird person. So like when you're seeing a healthcare practitioner who has their own culture, their own beliefs,
Right.
and like for those of us who study culture and have our own cultures, it's
Mm-hmm.
like, okay, I know that you know a little bit of what I'm experiencing, but the conventional model says that this is crazy. And so because of that, it was like, well, I don't want to be this, I'm not looking for validation because
Yeah.
your validation is not going to change my reality. I want
Mm-hmm.
someone who is not going to judge my reality because it just is, and I cannot control what I cannot control.
Mm-hmm.
So having that experience is really what like I was like, well, how can I like help? How can I like not just help myself, but I want to help other people who
Right.
may find themselves in these experiences. And that's literally how I became a naturopathic doctor. It was like part motivation, like
Mm-hmm.
I need a doctor that will see me. And
Yep.
it's not that conventional doctors can't see you, but like when you have 15 minutes and you have these
Yeah.
algorithms that kind of guide your treatment,
Yeah.
it's hard to, unless they are breaking free from the system, and there are a lot of doctors who are,
Yeah.
unless they're doing that, then it's hard for them to step outside of, the clinician with the white coat that has to be sterile, right? And
Mm-hmm.
naturopathic doctors, it was weird. Like my first doctor is like, well, she's still my, I'm like, my naturopathic doctor,
Yeah.
she like, we hugged like
Mm-hmm.
after I was like, we hugged. And like I have patients when I was in clinic, and it was just like, I'm a hugger. And
Yeah.
I'm like, okay, I'm okay with it. I am one too. And
Yeah.
it's like breaking that barrier of just being one human with some knowledge, more knowledge, a lot of knowledge, and another human who is an expert on their bodies and their
Yeah.
experience,
Yeah.
meeting at one time, honoring the relationship that we have because there is still a therapeutic relationship that's
Mm-hmm.
existing,
Yeah.
but also recognizing that, I guess for me, the way I see, it's kind of like the yin and yang, but like
Yeah.
the roots of natural medicine were feminine,
Yeah.
healing, like nurturing.
Yeah.
So if I'm going to be that, that's what I'm going to embody.
Yeah. Going to the feminine, healers I'm going to get a little woo woo, which actually is what the name of the original healers in Chinese medicine were known as woo woos. They were the women. They were the first healers in Chinese medicine were known as woo woos. That was the Chinese, I guess, word for it. I learned this, of course, in my schooling. And, going back to that spiritual piece, yes, culture and tradition plays a big role in people's health and wellness, right? Um, that's a big part of Chinese medicine, especially classical Chinese medicine, is understanding the three-part being, the spirit, the body, and the soul, or the mind, you could say.
Mhm. Yeah.
And of course, in their
Well, the
etiology,
spirit, they would say
yeah,
spirit, Shen,
spirit,
right?
Shen,
Shen
right? Yeah, the
comes
little
from,
Shen and the big Shen.
yeah, spirit and soul, depending on,
Yeah,
but usually the Shen,
yeah,
because if we're looking at, yeah, the five Shens are still part of the big
yeah.
Shen.
Big
So
Shen, yeah. Yeah. And so all of those play a role in, etiology of disease, in their diagnoses, being whether it's yin deficiency, yang deficiency, blood stagnation, qi stagnation, etc. All of them have a nutrition, a movement piece, and then the Shen piece or the motions or the mind piece,
yeah.
where
Hmm.
it's, where is it at? Because we have the heart, we have the mind. Those are two different ways of looking at it. So it's really important that we understand where they're coming from in their spirit, journeys because it plays a role in health. And it's hard to see because, again, going back to Descartes and Newtonian physics and all that stuff where they separated the two pieces, but you can't separate us. We're all of those things in one. And that's what's so great about natural medicine. You know, women were the healers a lot of times in common man. If you go back during the dark ages and all that stuff, they were the healers. They were the herbalists. They were the ones that brought stuff. And unfortunately, they were usually burned at the stake.
Yes. Just give me one moment. I'm gonna turn on a light.
Okay.
Yeah, no, yeah.
So, that's the thing is understanding the nurturing, again, going yin and yang. Now, in medicine, because that nurturing spirit of the woman, she's there to give life, she's there to support life. That's the yin. It's about Mother Earth, if you get back to that, because she
Yeah.
nurtures, right? But
Yeah.
you also have to have the protective side. That's the yang side. And I think the protective side kind of comes out more in conventional medicine in a sense because it's very aggressive to try to bring you back to health. Surgeries and those types of medicines is really kind of very aggressive. We're going after it. We're trying to stop it, but it has its danger zone, right? There's a lot of danger on that side. A little bit less on the nurturing side with the herbs and the things like that nurtures and supports. And it tends to take a little time. And that's at least how I see it, the
Yes,
yin and the
yes,
yang of
yes.
medicine, because you need both sides. We need to have the ability to be able to do surgeries because there's times that we need that
Yeah.
support. And it's an aggressive nature. And that's a yang nature to me, is that aggression.
Well,
You can,
so I want
what's
to
your
add
thought?
a different, so like,
Give us your perspective.
and I feel like, so like when we look, so this is going off of Chinese medicine, looking
Mhm.
at like the yin and the yang and the heaven and the earth, right?
Yeah.
And like
Mhm.
the heavens being like the intellect, the spirit, that inspiration that one gets, we can look at it from the thought, the thought component, and if we want to look
Mhm.
at the earth, the body and just being and that kind of thing. But the intellect driven practice of medicine. So like
Uh-huh.
now we
Yeah.
have evidence-based
Mhm.
medicine
Yeah.
that is that is a very huge field of medicine, whether it's
Mhm.
natural or conventional,
Right.
holistic or not.
Mhm.
Evidence-based medicine. That to me is
Mhm.
yang based medicine. It's
Mhm.
coming from the intellect, what is in the heavens or the masculine,
Mhm.
versus like I can be with five different people, just sitting with them, having a conversation. I can ask them the same questions and it will go differently each and every time.
Right.
And it's interesting. So like I've been volunteering like on the weekends with the fire department and I can give with homeopathy, I can give one
Mhm.
remedy. And
Mhm.
the reason I'm giving the remedy, it can be to five different people for five different things. And they're all like similar, but very different. And to me, it's like, it's not like I'm saying, oh, this plus this plus this equals that. And it's not even like that. It's just like in the interview, I can ask a few questions and they're talking, and it's like certain things, like paying attention to their personality and like, it's
Mhm.
like how they're interacting with other people. And you get to see all of these nuances. And it's like, oh, and half the time, I mean, like, yeah, I'm using the repertory because that's like what we're trained to do, and that's how you get precision. But like a remedy will come to me. And it's like, you know what? Let me confirm my my
Your intuition,
intuitive
right?
hit, right?
So that's your yin you're saying?
Yeah, I mean, I feel like that's just like me being with a person, talking to
Uh-huh.
them. I'm like, yeah, I'm putting things into my repertory, but I'm literally just sitting with them, talking with them, being with them, and like what comes to me is like how I can support them. Whether they do it or not, that's on them, but like
Right.
this is with my patients in general. Like, how do I
Mhm.
end up having a conversation on Ayurveda with somebody who came in for something that's like not even, you know what I mean? It's like
Yeah,
it just
absolutely.
happens. And then it's like, okay, like I'm going to use this to support this individual. And that's more like being an artist is like,
Mhm.
and yes, you have to have the knowledge. So
Yeah.
there's nothing wrong with getting the knowledge or getting the
Right.
skill set.
Hmm.
Having those skill sets, learning the evidence-based knowledge, and also knowing, like for me, like I did go on the non-evident, I'm like, I go on the spiritual medicine trip. I go on the mind body, which is also evidence-based. But the
Hmm.
way that I use it may be to create my own evidence or to synthesize things that are seemingly separate.
Hmm.
And I feel like as a doctor with a lot of tools in my toolbox or in my medicine bag,
Yeah.
um, like being able to like bring things and match even like multiple therapies that may work synergistically. So like in herbalism and
Yeah.
even in acupuncture, when you're picking a point, you're not just going to pick one point. You're going
Hmm.
to pick points that are going to help support and drive the treatment in a direction. You're
Hmm.
going to pick herbs. So I can use herbs. If I choose four herbs, I'm going to use herbs that are either working together to achieve or they're going to balance out or,
Hmm.
eliminate a little bit of the toxicity. There's so many strategies in how we work together, but the goal is to at least have one synergist that's going to help amplify what the main herb is so that
Hmm.
you're getting the desired result, but you're using the whole plant and you're boosting. So
Yeah.
it's different from that perspective. And I feel like when I'm bringing all these tools together, my goal really is supporting the nervous system, and the immune system. Like those are the two areas that I work. It's like
Yeah.
how am I supporting the nervous system? And it could be something like hypnotherapy, like you're working in trance. So
Yeah.
you're already in a like my work is to induce a relaxed state. And
Yeah.
even if I'm not using hypnotherapy when I practice Reiki, somehow like Reiki is inducing a trance. It's putting you in that deep state of relaxation.
Yeah.
I'm not like directing them and giving them suggestions or having conversations per se. I'm letting them just have their own experience. But I found that majority of the work that I love to do is in that relaxed state and
Hmm.
supporting the parasympathetic nervous system. And in supporting that, we know rest and digest, fight or flight. Fight or flight is sympathetic. And
Yeah.
that's where a lot of us reside. And that is where there's a lot of disease created there, chronic stress, right? And it's not
Hmm.
turning off. And then that impacts your genes. And
Yeah.
then your genes are mutating at a higher rate because they're not having a time to just chill.
Yeah.
So I like to allow people time to just chill. Some
Hmm.
people are able to chill with me, some people are not. And some people it's like a work in progress. It's like, how do we address the resistance to this therapy
Yeah.
instead of like, oh, this therapy won't work. It's like, no, there's a reason why you're resisting it. So can we like get you to a place where you're open to it,
Yeah.
right?
I liked your analogy on the herbs, but I was kind of thinking of, because that's kind of where we'd like to be in using the mindful table and bringing knowledge and stuff is really integrating the medicines, right? And I was thinking of that in accordance with, building an herbal formula. How can we make, you could say, an herbal formula of our medical system, our healthcare system, right? The synergy that we need, because I think that's where our medicine is heading because of some of the gaps that are there in care that we sometimes see, and also helping to alleviate some of the resistance that I see popping up in populations. People are looking for a different way because maybe, some medical traumas or different things like that, just because of the system, like talking about the 15 minutes, they're not being heard, things like that, is how do we bring together that synergy, that balance in medicine so that our patients, our clients are getting full scope care, in that area to where we can know where we fit in, where we can make that balance with conventional and bringing us into it where we don't have to say this is complementary, this is alternative, this is health care, you
Yeah,
know.
this is medicine.
Yeah.
Yeah,
So
I feel like that's the thing. It's like for some of us, the complementary medicine is conventional. For others, the complementary medicine is what we do.
Yeah.
And the reality is, like, I studied for 4 years. I studied biomedicine. I have all these my modalities, and
Mm-hmm.
I took my board exams. I studied medicine just like, my
Mm-hmm.
conventional peers.
Yeah.
And, medical doctors, their specialty are in pharmaceuticals, surgery,
Mm-hmm.
and they get a little bit of the nutrition. Whereas for us, we get a lot of the nutrition, a lot of the herbs, we get a lot of the modalities that we use, physical medicine. We get like, for me, I did even more with homeopathy. And we also do get more mind-body medicine and therapeutic counseling, positive psychology um,
Mm-hmm.
as part of our training, whereas their psychiatry has their own way of addressing the mind-body. And so,
Mm-hmm.
like, for like what ideally, yeah, like it would be lovely to be able to see medicine be medicine, like in India. If you're a
Mm-hmm.
doctor, you're a doctor, you go to doctor school, you go to medical school. And
Okay.
even in China, you go to
Yeah.
medical school and then you learn your specialties. So if you're going to learn traditional medicine and specialize in traditional medicine, guess what? You have to go through the rotations. You still have to go through OBGYN. You still have to birth a baby. You do have to do some of the surgery, but you specialize in the Ayurveda, or you're going to specialize in the acupuncture, the herbs, or even if you want to do physical medicine, like a chiropractic or osteopathic manipulations, like you get to choose the specialty knowing that you have the knowledge. And if you
Mm-hmm.
want to do lifestyle nutrition, I mean, like your tradition, like you study traditional medicine and you have the philosophy at the core, and then we also have the evidence. So I
Mm-hmm.
feel like it would be, I mean, there's so many reasons as to why we don't have more of an integrative medical system. A lot of it is the political economic history of the United States. But like I do, one of the things that I like to do is just to look at envisioning and how
Yeah.
can I make steps or take steps so that I'm actually creating that reality versus like um, fighting against a future that we can actually work together and honor each other's
Yeah.
education. Because, now you have conventional doctors who are doing like functional medicine and integrative medicine. And I'm not against that. The way that they do it is different than the way that I am trained to do it. The way
Yeah.
that I'm trained to do it is already from the holistic perspective. It's never been from like parts and then coming back. And then with my specialties, like working with herbs directly, like plant medicine, going out wild harvesting, creating medicine from plants, doing homeopathy. It's not like these are things that we grew up with in our education. It's not something
Mm-hmm.
that, we're being added. Now, the thing is, we also do get pharmaceutical pharmacology
Yeah.
knowledge. We do
Mm-hmm.
train in it. And yes, like you're either going to use it clinically or you may not, but we still have that knowledge. And
Mm-hmm.
we also do minor surgery. So depending on the state you're in, somebody comes in and they need to be sutured, you can suture them, right? Because we have that piece, that primary care education. So I feel like, it goes back to like, how do you want to practice and how do you want to serve your patients? And
Yeah.
it'd be so beautiful if we were able to do that more, like more, like there was just a healthier flow between it. So that's actually one of the things that my intention is to share my work with some of my colleagues who are medical doctors and doctors
Mm-hmm.
of osteopathic medicine so that they have an understanding of the work that I do and how I can help their patients and
Mm-hmm.
and that allows me to send patients their way that may benefit because if somebody comes in with hypertension, I'm like, yo, like this is a lot higher than it needs to be, like a lot higher. Like I'm sending you to urgent care or I'm sending you to a doctor
Yeah.
who can prescribe or who wants to prescribe. Because I'm like, that's you studied that, you do that. You know, if
Yep.
that's what, that's your medicine. I want to respect that boundary. So I
Yep.
want, for me, this is me. These are the things that are important to me. So I want to send patients their way. And that way we can have that beautiful relationship of reciprocity.
Yep. And that's, kind of where I'm looking to head to is really, I'd like to get into the community and educate on why, and I'd like to see even health coaching come up a little bit more into the education realm. I mean, I'm probably a very high educated health coach in relation to what is usually prescribed. Now, I have seen that they're getting that way for, like, if you're going to use insurance funds like your HSA or your FSA accounts, you can use certain health coaches, but they have to have a certain amount of education, which I think is great because it's not regulated yet.
Yeah.
And that's a hairy spot we ain't gonna go into.
Yeah, we don't need to go in there. I could tell you my horror
But
stories and piss people off. We're not doing that
yeah,
today.
but is understanding the need for a good foundation piece, practitioner, because they don't have time to do that kind of work, right? MDs, they don't have that.
Exactly.
And, and so being able to make a connection and even showing how why a naturopath can even fill in that gap, and of course several tiers up, so that we can keep people in it before they get that diagnosis. So like telling them, okay, if they're in this range, they're in the pre-diabetic range or the pre-hypertensive range, or they're not in a diagnosis. So for diagnosis they have to do the prescribing usually, right? So
Yeah.
we can kind of catch
Yeah.
those faults. People are coming in and they're telling me I got this and this, and they're getting disillusioned because a lot of them, I know I've worked in it as a health coach in another practice, in a functional practice, and I had people coming in and they're telling me their stories and they're crying because they're not being heard. They're fatigue, chronic fatigue that's not within the realm, so they're not have a diagnosis, but they're not feeling great, right? And so they're feeling like they're not being heard, and they're just not, they're preclinical, they call it, right?
Yeah.
And that's where we kind of fit in, is because we know, again, in Chinese medicine, the same deal is we see the yin and the yang getting out of balance. And that's
Yeah.
when we're like, oh, we got to tonify here. We got to take away the excess over here. And it's a lot of it comes down to the foundation piece. And then we have the energetics piece.
But there's also
Talk
the
about that
diagnostic
later.
piece, right? As a
Right.
Chinese medicine doctor,
Yeah.
you can look at
Yep.
tongue, you have the pulse, you palpate. If there's a
Yeah.
discrepancy in temperature, you're able to gain that information
Right.
from the patient. And there are patterns that you can see that, like we may call a deficiency or excess pattern, or
Yep.
it's an internal, or excess pathogen or external pathogen. So, like, if you're looking at it from that perspective, then you already can be like, well, even though it's not showing up on the labs,
Right.
or, for from a functional medicine perspective, I'm looking at your labs. This is a little not where I want it to be. So
Yep.
it's like we just have a lot more tools to gather information, and our therapeutic ranges or our skill sets
Mm.
for diagnosis give us information that the conventional model just doesn't use.
Yep. And that's their viewpoint versus others. And that's why we can work together and fill in the gaps, and that's what I'd like to kind of get as I build my coaching practice, is to build that awareness, to say, hey, if you've got clients, and the same, I'm gonna, you come in and your blood pressure, like you said, is sky high. I'm like, go.
Yeah.
You go. You're not controlling, sugar, any of those things. You're going to go, because that is where you
It's
need that
dangerous.
support into it for that time being, because it all works together um to give people the overall health and well-being. And I just really would love to see that in our community.
Yeah.
Is
Yeah, because
that
I
that
mean, I always tell our patients, like, look, especially, well, for me, it's like when it's in a dangerous range, right? Like, there
yeah.
are, like, it's like, there's just like dangers for stroke and like heart attacks and things that, like, it's like, why stress yourself to that? Why put yourself in that situation when we can work together while you are receiving this medication? Because I've actually had I've had like while I was a student, it was great. Like having patients who were like non-compliant, they weren't
Mhm.
taking their medications as prescribed. And so then like we had a conversation because as you know how I can be. I'm just very direct and real with a person. Like, look, at the end of the day, do I want to help you and can I help you stay off of medication? The answer is most likely yes. But in this moment, your body's reaction to your stressors are so like non-consistent
Yeah.
and uncontrolled that as we're working together, especially with the mental emotional picture, because the thing is, while I'm working with people, if I'm bringing up your emotions, after the session, you may like have like stronger emotions. It's a side effect to the therapy, right? And so I want to make sure that if it's dangerously high or if it's like been high for so long and it's just like, yeah, I can work with you from a natural perspective. I've got herbs for that, yes. But like you have to know your patients. If they haven't been complying before, there's a reason. And so until that reason is addressed, sometimes I believe it's better to be safe than sorry. So
Mhm.
I would rather have them follow said protocol in the conventional model, that knowing that, look at your numbers, they're dropping. Like you
Mhm.
come in, your blood pressure even controlled is like this. Since we
Mhm.
started working together, you are more here. You keep this up, yeah, you're going to be weaned off of your blood pressure medication. We're healing the mental emotional component, so the stress response is different. And then here are ways that I can support you, whether it's with adaptogenic herbs or it's supporting something else. It's like there's so many ways that I can support you once there are people who are gung ho, they are compliant, but then the people who are not, who are serious about changing, sometimes they need that additional help. So I want to work with I don't know. I just like that because sometimes I was like, I want to specialize in what I specialize in.
Yeah. Right.
And I do like have that knowledge, but there's an art to prescribing and I'm better at taking people off, So let the people who want to prescribe do that. And they also are great at it too. But I'm just like, I would rather just use my knowledge and support the patients in that way so that we're working together,
Yeah, I
you know?
think that's ideal right there, right? We got, people want to try to get their hands in everything, and it's like, dude, you can't do it all. And
And you
that's
can do a lot.
you can try.
No, but you can do a lot. I mean, like
Oh
having
yeah,
here,
there's a
because
lot
I
we could
have all
do.
these tools, people are
Mhm.
like, well, how do you I know? I'm like, no, you can do a lot, but at the same time, I know my limitations. I am not
Yeah.
going to be your surgeon. I am not going to be your prescriber in that way. I will prescribe you some herbs. And if things like, for example, like long COVID, like I've had people reach out to me, it's like, look,
Mhm.
it ain't working. So, and that's where it's like, okay, well, I can support you, and this is how I'm able to support you. And I use
Mhm.
my herbs and I use my homeopathy,
Mhm.
together.
Yeah.
So it's like there's a lot that we can do and still allow them to maintain that relationship and encourage them to maintain their relationship with their other doctors.
Mhm. I
Yeah.
know what at Taoist traditions where I go to school is one of our classes is the collaboration class because we're really trying to get that the team-based healthcare, right? To where we can see where we best fit, the not where we best fit, but giving the best care to our patients and clients,
Yeah, patient
and
centered.
huh?
It's patient centered. So it's
Yeah,
about the
patient-centered care,
patient, not
right. Yeah.
about, yeah, the
Yeah.
practitioner.
Right. And that it's a team so that that's the goal is to give them the full on care of every angle of their health and well-being. And that's where, of course, we had talked about how we have to go out and educate. And I'm like, I'm going,
They
you
can't
know,
stop you. No, like
but
for real.
yeah.
No, they're not going to stop you from educating. You're going to go out there and
Yeah. So Lord willing, this mindful table talk is going to get out there and start, getting the community talking and say, yeah, we need to start looking at all of, the complementary, or they call it complementary and alternative medicines, and how do we bring these cares together? And I'm seeing it in little pockets. I think Duke University has started incorporating some integrative care there.
They
I
have
know
a
out in
long time
Arizona.
though.
Huh?
It's there are a lot. There's a lot. I mean, like when I look
Mhm.
at some of the mind body research, um, Harvard has like Harvard. A lot of the bigger names have them, and then like being out here in California, like there are a lot of integrative health institutes. So the like we exist and we want to be a part of the healthcare community,
Mhm.
because it does help the patients, right? Like if especially with our insurance model, so it's like
Mhm.
if there's a way that we can work together and essentially minimize the cost for
Yeah.
patients, but also we're all being able to utilize our knowledge in the way that we practice, because I don't
Mhm.
want to work on 15-minute interviews
No,
intervals. I would
no.
like especially with hypnotherapy, it's like 2 hours. I'm not gonna lie. It's like,
Yeah.
but it's because of the levels and to give people time. When you have
Mhm.
someone who has a hard time, like people who have dealt with histories of trauma and abuse,
Mhm.
they don't know how
Mhm.
to label their emotions.
Yeah.
So helping people and just sitting there and not rushing a patient when they're trying to just be like, you ask a question, it's just like, oh, I think it's been 60 seconds, and it's just like, oh no, like actually they respond, like they will respond. They're really just processing it
Mhm.
and allowing that time. That's something that I value and I'm able to give to my patients. So I want to continue that. But yes,
Um,
I look forward to us being able to continue to share and educate people um, with the Mindful Table Talk.
mhm.
I know our next episode, we
Mhm.
were considering talking about the therapeutic order, right?
Yeah.
So understanding the therapeutic order as a foundation of care.
Right. I think
Yeah.
creating, and so I think that's what our next conversation is. We're kind of coming to a close here. I think this is a great way to segue to that is we're talking about how do we build that community of healthcare practitioners. And I think that's one of the greatest models that could really be utilized in our healthcare system is the therapeutic order, because all of the different types of practitioners medicines fit within that model, which is pretty amazing. So I look forward to talking to you about the therapeutic order and getting your take and, sharing my take on what I see in the therapeutic order in our healthcare system.
Yay. Well, it was so great to be able to do this with you, this podcast. I look
Yes.
forward to seeing you in a couple of weeks for our
Yes.
next episode, so that we can talk more about the therapeutic order and really help educate people on what the therapeutic order is in naturopathic medicine and how we use the therapeutic order to
Mhm.
support patients and clients. And
Yeah.
then also, how do we use it to triage, right? Because
Yeah.
surgery and higher force interventions using prescription medications are on the therapeutic order,
Yeah.
and being able to use it as a model of care.
Yes.
Yes. Well, thank you for joining.
Thanks for having me. Yay.
Yeah. All right. So next time we will be back at the Mindful Table Talk, with health empowerment coach Joanna Mickel. Joanna, how do people find you?
You can find me on www.healthempowermentcenter.com and on Facebook for Health Empowerment Coaching. That's my page there on Facebook. So I look forward to seeing you on either one of those areas.
Awesome.
And
And
how
you
about you?
oh, thank you. Yeah, you can find me at heartbodyglow.com. It's Heart Body Glow Naturopathic. I'm also I am on all the socials like Facebook and Instagram, but I do a lot more through we're doing this, and then
Mhm.
also I do some newsletters. So
Ah,
yeah. All right. Well, talk to
yeah.
you again soon.